If you're a driven, active person who wants to reach and pursue a higher quality life with some ambition, then guess what? This podcast is for you. This is the Driven Athlete Podcast. What's up, y'all? It's your man, Dr. Kyle. Welcome back to the Driven Athlete Podcast. We got a great guest with us, someone we go back with history with, but Melanie Craft is here. She's a nurse practitioner. Thanks for coming. I know you're busy, so I appreciate you coming in.
Thanks for having me.
So tell everybody where you're at, what you do, and how you help people.
So I'm a nurse practitioner, and I just opened my own business in aesthetic medicine. It's just me right now. So
It's in Gardens, right?
It's in Palm Beach Gardens. Yep. And I have about 8 years experience doing aesthetic medicine. I've worked for a few plastic surgeons. I've always loved working in the operating room. I like using my hands. I like suturing. I'm very detail oriented.
Not everybody likes that.
Not everybody likes it. I do. I'm not scared of the sight of blood kind of thing.
Yeah, good. That's important.
Yeah. So I've always had a passion for learning and growing and always taking things to the next level. So I feel like moving in the direction of aesthetics is neat because there's so many new things on the horizon. And there's so many ways to blend wellness into aesthetic medicine. It's not just all about fixing people's faces or making them look younger. I think there's a lot more to be discovered just from beauty within.
Like, what do you think? Like, what do you think what direction do you think it's going to go?
I'd like to go into the direction of like regenerative medicine. Everybody's kind of heard of PRP, but not everybody knows what it is or what it does. And not everybody's PRP is the same. So in the space of regenerative medicine, people are looking more at like exosomes and platelet-derived growth factors that are kind of harvested and stimulated in a lab. And we can use those to stimulate the body's own production of collagen. And you're kind of going to see medicine go in that direction because people are kind of getting away from more like the synthetic stuff like Botox and fillers and stuff.
Gotcha.
Yeah.
So PRP, tell people more about that. It's platelet-rich plasma.
Platelet-rich plasma. So,
and how, like for aesthetics, how would that be applied?
So you draw it from blood. I was working for a plastic surgeon in New York, and we'd basically draw your blood, you spin it in a machine to separate out the plasma from the blood part. Mm-hmm. And you take just that portion and you can kind of inject it anywhere. And so we would inject it kind of before we close any incision. And it's supposed to stimulate the body's own healing factors. And It's just all about tissue repair. So in aesthetics, you could use it if you're doing microneedling treatments. You can inject it under the eyes to kind of help produce more volume naturally.
Under the eyelid?
Under the eyelid, yeah.
Wow. People are cool with that?
People are cool with that, yeah.
Oh my gosh.
I inject a lot of filler under the eyes, so
interesting.
Just helps restore volume.
Interesting.
Yeah.
All right, so PRP, sometimes eye filler applications.
Yep. I do a lot of, I'd say the most common treatment I'm doing right now are Botox injections, mainly like between the brows. Mm-hmm. Botox can be used medically to treat migraines, to help with jaw grinding.
Yeah, totally.
And it has a really great place for that. I don't do that as much. I'm more using it in aesthetic medicine, but I hear so many people come back and say, I was getting headaches at the end of the day, and when I get my Botox injections, I just don't have them anymore.
Yeah.
A lot of people nowadays are spending a lot of time on the computer.
Oh, yeah.
So that constant like tension and squeezing of the muscles there can create tension. Are you familiar with how Botox works?
Yes, but explain more to people.
So it can get a bad name because at basis it's a neurotoxin.
Yeah.
And it's used in very, very minuscule amounts and bound to proteins. When you inject it into a muscle, you're not injecting it into blood vessels, but when you inject it into muscle, it produces an effect of temporarily paralyzing that muscle.
Right.
Usually lasts about 3 to 4 months. In cosmetics, we use it in areas where people notice a lot of expression lines. So like around the forehead, between the brows, around the eyes.
Maybe wrinkles. Yeah. Expression lines. I like that.
Expression lines sound better.
I've never heard that before.
Yeah.
I like that. Sounds more elegant.
Yeah. It's being used more and more like beyond that. It started up here. It's kind of moved down the body to where like some people get trap Botox just to help reduce tension there. It can elongate the neck.
And then TMJ pain. So we see a lot of headaches and like neck pain,
Yeah.
some headaches that can come from like cervicogenic headaches. But yeah, we see that. I mean, that's a common thing, you know.
Yeah.
And then TMJ issues, like we help people with TMJ dysfunction, and we'll
Okay.
like do dry needling for that too.
Oh, that's great.
So like it's like a similar effect from what the research is finding from like the dry needling application to the muscle tissue
Yeah.
for decreasing the muscle guarding to help
Yeah.
with acetylcholine regulation,
Okay.
which Botox, botulinum toxin A, from my understanding, it blocks acetylcholine.
Mm-hmm.
Is that correct?
Yeah.
Yeah. So it helps with like, yeah, muscle tension. The thought with, so the lens, what we would work like for that, for like upper trap tightness or headaches and neck pain and stuff, or TMJ pain,
Yeah.
we're like, all right, your muscles are guarded, understood, but like, what, why? Like,
Yeah.
what is it you're doing, or why the joint mobility ratios between some of the upper cervical to the mid cervical, like why is some things getting more tight than others? There's usually an answer, right?
Yeah.
But yeah, totally, like this stuff can be helpful to help create relief,
Yeah.
you know?
Reducing tension.
So you're doing it for an aesthetic standpoint,
Mm-hmm.
and then the PRP to help stimulate a healing response naturally,
Yeah.
collagen fiber lay down. Totally. What got you into this in the first place to go the nursing route?
It all really goes back to my younger sister. When she was 4, she was diagnosed with leukemia. I was about 12 at the time, and we spent about 2 years in and out of the hospital with her.
Wow.
And there were times I'd be there with her. My mom would be like, hey, I'm going to run out. I'll be back in 20 minutes. I'm going to go get dinner. And I'd either be pulled into procedures with her, or I'd watch the nurses draw blood, administer chemo, blood transfusions. And I just was captivated by it, like just by the people working there.
Yeah.
And so that's initially what led me to the nursing career. My first job was in the neonatal intensive care unit. I worked in a level 3 NICU in Orlando. And
that's heavy.
it's very heavy, very intense, but I loved it. I think to this day, that was still probably the most fulfilling career I've ever had. But I've always had a passion for learning. My family jokes that if I could just go to school for a living, I would.
It'd be just a lifelong, like
just a learner. Yeah.
Student.
Just, I don't care. Just teach me. I want to keep learning and growing and meeting people in the teaching realm. I loved working through teaching hospitals and all that.
Cool.
So, the NICU I was working in, a lot of the girls were going back and getting their advanced practice degree, and everyone was doing something different, whether it be peds focused, NICU focused, family focused. So I chose family because I was super indecisive at the time. And I was like, I don't know if I want to keep treating babies or adults.
Right.
That actually ended up leading me to orthopedic surgery. I don't know if you knew that. I worked in ortho for 3 years for a shoulder and knee sports medicine doctor.
Amazing. We're in Orlando as well?
No, that was in Palm Beach Gardens.
With who?
Dr. Ryder, Brian Ryder, with Atlantis Orthopedics.
Oh, I know him.
Yeah, that was my
That's amazing.
first job. And I loved working in the OR. That was like the first time I was really in there and hands-on doing surgery, assisting with fracture repairs, reattaching tendons and muscles and all that.
Wow.
So that was cool.
So trauma then?
Not so much trauma, but just because we were more like sports medicine.
Yeah.
So a lot of injuries.
Got it. Yeah. Cool.
Yeah.
So then after that, you were there for 3 years.
I was there for about 3 years. And then at the time I was moving to New York City to be closer to my boyfriend, who's now my husband. And when I was moving, I liked ortho, but I wanted to maybe get into a space where I could do surgery that wasn't like super around the clock and urgent. So I was like, plastic surgery could be nice. I don't have to be on call on the weekends.
Yeah.
Patients aren't in pain. They're not hurting.
A little better work-life balance.
A little bit, yeah. And I thought New York was a really cool place to do it. And it was. It's super busy. I learned a lot. I saw a lot of things that you're not going to see in South Florida. So
where in New York were you at?
I was right in Midtown.
Wow.
Yeah.
Cool.
So
just hustle and bustle.
Yeah.
That's crazy. And how long did you live there? How were you there for?
About 2 years.
2 years.
Not too long.
Okay.
Just enough. I don't think I could be there long term.
It was a good experience.
A lot of subway commuting. You see a lot of things you don't ever want to see again.
Oh my gosh, I couldn't imagine. I've actually only been in New York, I think two times.
Really?
Yeah, one was for a high school trip, and then a second time just visiting my brother.
Yeah.
But,
did you like it?
I thought it was cool, and I was like in a certain stage of life, it could be cool.
Yeah.
Not now with the family, you know.
Yeah, no.
But a certain stage in life, you know, like a transient, like 1 to 2 year, maybe 3 year period, I could see that being fun.
It has a really good there's just like a pulsing energy in the
Right.
city.
Right.
People like are really hustling. They're working. They're trying hard.
Yeah.
It's like a grind. Like some of my days would start at 5:45 and I wouldn't get home till 9 p.m.
Wow.
We'd drive to New Jersey. We'd operate. We'd fly to Atlanta, Miami. There were facilities like all over the country we were operating out of. So
Wow,
it
that's
was
crazy.
busy. It was really fun.
That's intense.
Yeah.
Okay. So then from there, that's when you went more aesthetics?
Yep. So I was about half and half there, half my time being in the operating room, half assessing patients and seeing patients, doing like wound care, post-surgery, removing drains, all that. And that's when I got into the injectables. And I just thought that was really neat. It's very artistic. If you have kind of more of an artistic, creative mind,
Yeah.
you can really implement that in that space.
I've heard that with plastics,
Yeah.
like artistic. So that's a great, I mean, it makes
Very.
sense. It's a
Yeah.
blend, and the transition from that makes sense. So they went, all right. So they went aesthetics, and then you were working, before you opening your own facility,
hmm
6 months ago, 3 months ago.
Yep. I worked for another local plastic surgeon, and we did a lot of orbital and eye related type of procedures and surgeries. And I've always had this passion to go do something on my own and
Yeah.
just make my own space. And I kind of want to get into that other, like I said, that other space of regenerative medicine and
hmm
explore what that could do to help my patients. It's a really common question I get from patients is how they can anti-age from within and in ways where they're not like, I don't want to keep band-aiding what I'm seeing that's aging me, that's making me feel tired. And I'm just not super happy about what I'm seeing in the mirror. And
Yeah.
this little area bothers me a lot. And if I could, get that to look and feel better, I just think I'd live a better life and
Yeah.
that kind of thing.
What do you, this is going to be tricky, but like, what do you think the recipe in total would be, a comprehensive recipe for anti-aging? It's like, hey, I want to feel better, look better,
Yeah.
all that longevity.
God, that's a loaded question.
I know. Do you follow that guy, Brian Johnson?
No.
He's like the guy he's like the whole movement of don't die.
Yeah.
He's like a billionaire that like sold a tech company. But anyway, now he's just like full send on like, I want to age the slowest as possible in the world, but the
Yeah.
slowest ager.
Okay.
So he does like blood transfusions for his 17-year-old son. He has like the red light therapy, and he only eats from 6 a.m. to 11 a.m.
hmm
He doesn't eat meat.
Okay.
He investigates like microplastics and then
Yeah.
sun exposure and all that stuff, processed foods.
I think the overall theme would probably be like avoiding toxins. And I think that's
So we hear a lot.
it's like a lot more talked about than it ever has been. But I do believe we have a lot of toxicity in our world, in our
Yeah.
food,
Yeah.
in our skincare products. Fragrances is like a huge thing that finally there's really good brands and companies you can get good
Interesting. I
products
didn't even
without
think about that.
fragrance.
Yeah. What are your thoughts on like sunscreen? Same
I mean,
thing?
huge. My patients get so annoyed with how much I'm pushing SPF because we just get so much exposure from UVA, UVB rays, and it's literally radiation.
Yeah.
And it's so damaging to our cells, to our skin, to our hair, everything.
Would you recommend like just like a day-to-day lotion that includes SPF?
For sure. I mean, I think
Just to like
a
walk outside
mineral based.
to the mailbox, like go to the grocery store.
Yeah. If you can look for something that's mineral based, that's huge because a lot of regular sunscreens that you're going to find at the grocery store actually have a lot of toxins in
I was
them.
gonna say like what sunscreens do you is that a thing? Like I know I've seen that also in like the social media space of like
Yeah.
there's a benefit of getting the sunscreen to block the UVA, UVB rays. But then at the expense of like all the chemicals that you're absorbing through your
Yeah,
skin that comes with the
exactly.
sunscreen. What are those chemicals? That's not
So I don't know the specific names of them. There's some really good apps that I actually rely on. EWG is one of them where you can like scan the barcode of any product and it'll give you a whole profile on like the rating of that product and let you know like these are the things that are in them that are toxic and that are bad.
yeah.
And it kind of like rates it from like 0 to 10. You're looking for it to be kind of 0 to 1.
Yeah, of course.
And they have categories on like skin sensitivity, internal toxicity. I think if you can find more like physical mineral-based sunscreens, that's going to be key. A lot of medical grade skincare companies are making them.
What would that like? What brand would that be?
One brand I really like, I use a lot, is Skin Better. You really can only find them in doctor's offices. You're not going to find them in like Publix and CVS. But a really good CVS brand is called La Roche-Posay. They make great products that are like medical grade, but you can find them in convenience stores.
So the other one you can't find online or anything like that?
You can buy it online through their website, but you have to have a provider linked to the product.
Okay. Gotcha.
So it's not a prescription, but it's just kind of controlled in like more of a medical space.
Yeah. So you recommend that and just wear it as if you were wearing lotion.
Yeah. Wear it daily.
All the time.
And if all you have time for, I mean, I'm a mom of 2, so I'm busy. My skincare routine isn't as big and grand as I'd probably like it to be. But if you can't put sunscreen and then lotion, find a lotion that has sunscreen in it.
Got it. Yeah. That makes sense.
Yeah.
There's one social media influencer guy, he does like the ice bucket in his face, or the bowl of ice.
I've seen that.
Does your skincare routine include that?
It does not. But I've actually moved to washing my face with cold water. I think for a while we would say like heat, hot, open the pores, but I think heat can be kind of damaging to the tissue on the skin.
Gotcha.
So
you advocate for cooler water.
Yeah, I kind of like just like a room temp cool water. Although in Florida, our cool water really is like just kind of warm in the summer.
Yeah, it's like this is not quite as warm as bath water, but
yeah,
So
exactly.
for skincare routine, the mineral-based sunscreen.
Yeah,
wear it all the time.
Yeah, every day. We should wear it every day. We're getting sun exposure when we're driving, when we're running errands. I think a lot of people forget that. They think, oh, when I go to the pool or beach, I'll wear it. But we really should be wearing it every day.
Yeah. I remember like when like playing sports, like practice and stuff like that, I would put sunscreen on because we had like 2-a-days, like for football and stuff.
Yeah.
And I'll be like burnt, and I'm like, man, I got to put sunscreen on,
Exactly.
And guys are like, what are you doing? I'm like, I'm just like burnt,
Yeah. Have you ever seen the picture of there's a picture of a truck driver. And he drove a truck for like 50 years, and the sun exposed side of his face looks like 40 years older than the non-sun exposed.
Interesting. I have not seen
really
that.
Interesting.
I have seen like one arm will be,
and a hand from the driving.
Yeah, exactly. Because that's the one getting the sun from through the windshield. What else do you recommend then for like skincare routine?
I think everybody should be on some form of like a acidic exfoliator at night.
What's that?
So some of the common ones are glycolic acid, and retinoic acid. Retinol, you probably heard of retinol.
A little familiar.
It's derived from vitamin A, and it basically tells your cell cycle to speed up and exfoliate and shed dead skin cells faster than your baseline.
Okay.
And when you do that, you're actually creating new cells faster, and it kind of anti-ages the skin. So it shrinks pores, helps with wrinkles, makes your skin just look shinier and brighter.
Yeah.
But I think if everybody can find a formulation that works for their skin and doesn't over dry their skin, using it at least 3 times a week would be ideal. If you're looking for some type of skincare to take care of your skin in the long term.
Interesting.
During pregnancy, you can't use retinoic acid. So I kind of went crazy because I'm like, I can't use my retinol when I'm pregnant. And I went down a whole rabbit hole. There are some safe alternatives during pregnancy, like glycolic acid is fine to use, and like a toner.
What about nursing?
Nursing, it's recommended not to use it either. So same thing.
Yeah. I think it's just so interesting, like considering those things get absorbed in your skin that then can be passed through like through a baby.
Yeah.
But like sunscreen, deodorants, body wash.
I know.
soap,
They're not talked about as much.
Not at all.
Aluminum deodorants, like aluminum's a metal. I think they're finding a lot of like metals being toxic to babies and kids, and their bodies can't process metals as quickly and as much, and they can't handle the load that like adults can.
Yeah.
And there's a lot of products that are heavy in metals. I went down a whole rabbit hole on the baby foods recently with like jarred baby foods. A lot of companies are not testing the quantity of metals in them, and it can be toxic.
Interesting. Which makes total sense.
Yeah.
It's some kind of processing,
Yep.
and then the packaging.
The soil, it's like, there's like the 4 points of it that
I've talked, I'm like, where does this, like with this environmental toxicity, what does this look like in 20 years?
I know.
Like where are we going? Like, what are the options?
I think we're going in a good direction, but I feel like it's also one of those, like with knowledge, comes power and understanding. And I think we're going to learn a lot of the things that we've been doing and using and putting in our foods and products are just really bad.
Yeah. Man, that's crazy though. And then do you recommend microneedling?
Yeah.
Like what is that? And then do you recommend that like on a regular basis, like monthly?
Yeah. So you could do it monthly. It's not really necessary. Usually people will do like 4 to 6 sessions spaced out over like a few months. Um, and it's basically a little handheld device, and it has varying amounts of needles in it, depends on which device you have. And they vibrate and they have different depths that they can puncture the skin. But the idea is kind of like gardening. Like
So
when you
aerate the
garden,
soil.
you're aerating the soil and then you're putting fertilizer in it or whatever you're using to kind of help get nutrients to the plant to make it grow. It's kind of the same thing with the face. And back to PRP, you can microneedle and then take PRP and kind of smear it all over the face.
Put it all in there.
They call that the vampire facial.
Oh, okay. Makes sense.
Yeah.
You know, have you seen those like for hair loss, like the little rollers, like lawnmower rollers?
Yes.
Is that the same thing?
I think it has a similar idea, but it's more meant for like home use. Patients are going to get access to a microneedling device to use at home. So I definitely think anything that can stimulate the skin and blood flow can be great. But hair loss is another interesting one that
100%.
I want to get into in the future. And just stimulating hair growth, giving patients other options other than going for hair transplants, kind of thing.
For sure. I would. It seems like the aesthetic, the umbrella under there would also include like hair loss, wellness, regenerative medicine.
Yeah.
With the so tell me this: what kind of population do y'all see? Like, what's like your demographic?
I would say, I mean, I'm seeing majority women. I do see and treat some men, but the most of it is women, anywhere ages late 20s to, I had a lady I saw the other day that was 82. So I've got a pretty wide range, but on average, I'm seeing women in their 30s, 40s, and 50s.
Gotcha. And then they come in with usually the same questions.
Yep. Usually the most common questions
expression lines.
I have expression lines. I have a wrinkle right in the center of my eyebrow. That's probably my most common, or 2 between my eyebrows. And it just bothers me when I look in the mirror, and I just want options to get rid of it.
Yeah.
Smile lines here in the nasolabial folds are another common one. One of the first places we start losing volume on our face as we age is the mid-face. And so I get a lot of patients coming in feeling like they feel sunken there, sunken in the temples, and they're just looking for ways to restore volume, take care of their skin. So they just want to age more gracefully long term.
Gotcha. With like mid face and then temporal sunken features, what do you do for that? And what's the treatment for that?
My most common treatment is using a hyaluronic acid filler.
Oh, okay.
Yeah. Which it's funny because when I first got into aesthetic medicine, what I knew of hyaluronic acid was from my ortho days, because we would inject it into the
joints.
knee, to the knee joint to help treat some of the symptoms of arthritis.
Yeah.
And we use it as a filler in the face, and it can last anywhere from 6 to 24 months.
Interesting.
And I'm basically just revolumizing areas where the patient once had volume. So I'm not trying to change the structure of the face or make people look any different. I'm just kind of restoring some volume loss that they once had.
From my understanding, the hyaluronic acid from a soft tissue standpoint, like for collagen, it helps with gliding between, like the pliability between collagen fibers.
Yeah.
Like when we do soft tissue work, like if we do stripping or cupping or something like that, the thought would be like it stimulates a vasal response that delivers beelines hyaluronic acid in the area too. So like imagine like getting a massage or like getting like some soft tissue work, which is not super comfortable.
Yeah.
But then they're red and they're like, I was really uncomfortable during, but then they stand up and like, oh, I'm like a lot looser.
Yeah.
It's like, what happened? From my understanding, it's like the research is describing, it's like a more hyaluronic acid was recruited and delivered in the area that's allowing more fiber gliding.
Yeah.
So that'd be the same thing for the face, like for aesthetics?
It's similar. I mean, I'm putting it in areas like where some of the fat pads are. But it likes water because it's like a hydrator. So it's very water loving. And so it will draw water into where I inject it and will actually kind of help with a little volume as well. There's different types of fillers. They all have different properties and they're used in different areas for if you want something firmer or if you want something that's really flexible and stretchy and you want it to like look more natural. So that that's where like the artistic component kind of comes in. But yeah, very similar.
Cool. So what would like, let's say a lady comes in, your main demographic would be like 30s to 50s female, and they have expression lines and they want to feel confident. Like they want to, what, and skincare, longevity. What's the best recipe for that?
I'd say the best recipe, in my opinion, would be using Botox to kind of soften some expression lines every 3 to 4 months. It's going to be common that I'm injecting filler into like the mid face area
Okay.
and sometimes along the jawline.
Okay.
I'm not really big into lips. I like correcting lips and using it for soft hydration, but I don't like when lips look fake or overfilled.
Too
and
much. Yeah.
It's just not my thing.
And then I would imagine microneedling and PRP.
Microneedling, yep, occasionally. I like using chemical peels because they're basically like the exfoliating acids I talked about earlier,
Yeah.
but in really high concentrations, and they cause like a rapid shedding of dead skin cells and tissue.
So is that a cream?
No, it's a solution I apply in the office.
Oh, okay.
And then they leave it on for a few hours, and then they get like a little take-home regimen to care for their skin. And over the course of a week, they like peel.
Interesting.
Yeah, like a snake. You kind of shed skin.
Huh. Interesting.
So doing that, I think 3 times a year is awesome. I get patients on a good skincare regimen. I always tailoring it to the patient, just depending on what their needs are and how much time they have and want to invest into it.
Yeah.
So I think good skincare, little Botox, filler to restore some volume. I think that's the perfect recipe, but also understanding that it's like maintaining a car or coloring your hair. It's not something you just do once.
Yeah.
You got to kind of stay on top of it.
Yeah. So they
keep up
recommend
with
patients to come back and see you like what's the cadence look like to come in?
If it's a new patient, I like seeing them back at 2 weeks just to kind of assess whatever it is we did and make sure that they responded appropriately, answer any questions they may have. But ideally, I'm seeing patients every 3 to 6 months.
Gotcha. And then just continually coming in if like something comes up or like as needed
Yep.
more frequently.
I've got a lot of seasonal patients too. So I also kind of work with them if they have other treatment providers, usually up north where they go. And I'm very transparent about here's our treatment plan. This is how much Botox we've injected. It's the type of filler I used. Because a lot of people don't know that. They'll come to you and they'll say, I had filler a year ago. I don't know what it was or where they put it.
Yeah.
And you're like, okay.
Which is kind of interesting because we have a very similar conversation with patients. As in like, I went and saw this one PT or chiro or doc or whatever, and they did this thing and it hurt. I didn't feel great afterwards. I'm like, who was it? Like, where were you at? And they're like, I don't remember.
Yeah.
I was like, man, like I feel like I'd be a little bit more conscientious.
Yeah, writing it down, what's going in my body. But I think if you trust your provider and they've given you treatments that you like the result and the outcome, they just trust you and they're going to do whatever you recommend. So.
Yeah. Gotcha. What about blemishes? You got questions on that? Yeah,
I do. I think cosmetic dermatology is something I highly value and respect. And they're more going to be in the wheelhouse of treating rosacea, acne, all that. I do some chemical peels for it if they're already on some type of medication or regimen at home. But that's another one where I think there's a lot of internal factors at play. And it's just a problem of inflammation, like a lot of things.
Interesting.
And I know you.
For what particular? Like rosacea, you're saying? Or
rosacea and acne. It's just inflammation of the pore and the tissue that exhibits the symptom. And so it's not just inflammation from the external environment. I think there's a lot at play with the internal.
Interesting.
What they're eating and
what they're eating. Yeah. Totally. Consuming, drinking, eating.
Yep.
Lack of exercise.
Stress, loss of sleep.
100%. Kids.
Yeah.
And then hormonal imbalance, dysregulation, from all the whole, because that's a traumatic thing,
For sure.
Pregnancy, birth, nursing.
Oh my gosh, you're telling me.
Lack of sleep.
7 months out.
Yeah. So you have 2 kids.
Yep. I got a 2.5-year-old daughter and a 7-month-old baby boy.
Man, that's crazy. Yeah. I can't believe 7 months already.
I know. I can't either.
Yeah.
It flies. But I'm happier in this phase when they're actually like sleeping through the night. I struggle with the newborn phase of like the sleepless nights in the beginning. You know that.
It's the worst. I mean, Nicole takes the brunt of it. I mean, I help usually to like put them down. Like she'll wake up to nurse, and then they're usually just, man, they just want mom.
I know.
So when mom puts them down, they're like, no, like I need you.
Yeah.
They just sense and smell them, smell it. So she's like, can you come in and put him down? Yeah. Because Maverick now, he's 9 months.
Okay. Yeah. I knew he was close to.
He hasn't slept the whole night once. I actually like
No, he hasn't.
he slept through the night one time.
Okay.
All the other two kids got up like 3 times that particular night.
It always goes that way.
It's crazy.
I was blessed with this dream child. At 4 months, he just started sleeping through the night.
Amazing.
And I had heard that happens. I didn't know it was possible. And
Yeah.
he just did it.
Our middle son, Colt, was like that.
Yeah.
He like started sleeping really well within like 2 months, I think. And then it lasted up until he started teething, I think.
Okay.
Or some kind of leap happened at 6 months maybe. But anyway, there was like a 2-month stretch, I believe, where, Blakely was old enough where she's sleeping well through the night.
Yeah.
And then, Colt was like sleeping. We're like, this is kind of easy, like if it could be like, this is awesome, but Mav has been he's been more challenging, but yeah. So I'm on there. She takes the brunt of it. I don't know, like the lack of sleep, man, it's like,
it's brutal.
Just constant broken sleep.
Yeah.
Man, it's crazy.
No,
I
think fatigue is like a form of torture, like just not sleeping at all. And it affects so many systems of the body.
Right. Yeah. I know that for talking about longevity, something I've heard multiple sources where they're like the first, like comprehensive recipe for longevity and like anti-aging, be healthy, wellness or whatever. They're like, get your sleep locked in. Yeah. Like be military consistent and like regimented with like, no, I'm in bed at 9 and I wake up every day at 5:30, whatever. And then like lock that in. Yeah. Just because like all the processes and recovery things that happen at sleep, one of them being brain flush, like getting all the trash proteins flushed out of the brain. Yeah. And I was like,
I've never thought about that.
Well, then we're doomed.
I'm learning now that we have 2 kids, my husband also owns and runs a business. He's in insurance. 2 kids, 2 businesses. I found that I need to become more of an early morning person. If I want to get like my me time in, whether it be yoga, exercise, or just like having coffee and, reading some news, it has to be in the morning. Yeah,
I could agree with you. Yeah, I believe it. Because yours are grinded,
It's busy.
Businesses. And I'm fortunate where Nicole, like, she's at home with the kiddos. Yeah. Like, that's like her thing, Yeah. So it allows me to like get out here and, grind and stuff. Yeah. But, the me time, like for sure, fortunately, all right. So there's a question. All right. So you're, active, healthy, professional, health industry. How do you navigate with 2 kids, running a business, getting your own longevity, health, wellness, nutrition stuff? What are your recommendations?
I think I've had to let go of a lot of not everything's going to be kept up with and done 100% of the time. So if my house is a wreck, if laundry's piling up, if like dishes are left from the morning, that used to be something that really got under my skin and bothered me. Yeah. And I've kind of learned to let it go and just know it'll get done. I'll finish it later. It's not a big deal. I think just focusing on like the important, like trying to get up early, get my workout in and be done by 7:30 is key. I don't do it every day. I couldn't do it every day.
Where do you work out?
Usually just at home. Oh, okay. Yeah, or in the neighborhood. We were members at Lifetime for a while. Then I paused it when I had the baby, but I love Lifetime Gym. They're great. They've got everything, good classes. Yeah. But for now, I've just kind of been at home. Gotcha. I kind of like to run in the summer, which is crazy. I can't last long. It's only like 20 minutes, but there's something about just sweating that's like, feels really good. I love the endorphins it creates. It's really therapeutic.
How is that is that a recommended thing for skincare? Like get some good sweats in?
Run out in the sun in the summer, Florida? Probably not if I'm like preaching my SPF, but no, I think sweating's good. I think, the anti-aging healthier way to do it is in like a sauna or like a steam room. Yeah. But I just, there's something about the Florida heat and the sun and just sweating outside that feels like really good and really natural.
Yeah, I don't disagree with you. It feels good. Like I did something hard and like it's healthy.
Yeah. It does something to your body. I think heat conditioning.
For sure.
Yeah.
As long as it's safe.
Yeah, exactly.
Have worked out in like 6 months. I'm gonna do trash bag runs in the heat. Yeah. Like, no, not a good idea. We're not saying.
Gotta ease in.
All right. So your recommendations. If you're a busy person, you got a lot of juggling, a lot of stuff. Yeah. Let
little things go.
Let the little ones burn. Like just let that little fire, the laundry, the dishes. But like I need to make sure I get to bed, wake up early,
Yeah.
work out.
Get to bed on time. I mean, my husband and I like having at least like a good hour and a half to 2 hours after the kids have gone to bed to just kind of relax, whether it's like reading, watching a show, chatting, catching up. Usually I'm like kind of prepping for the next day, getting bottles ready and lunch. My kids are in daycare at a little church right by our house, which is great. So yeah, letting little things go, trying to have somewhat of a structure and a plan to your day. I'm really big on to-do lists, like having a list of like, okay, these 5 things I know I need to do.
Yeah.
What are the 2 most important? Because I probably won't get to all 5, and like get those done. And my husband's been really good at helping me like just check off boxes and like find the easiest thing you can complete on your list, do it, complete it, and then it's done.
Yeah.
And then it kind of just feels good. You're like, okay, I accomplished something.
Yeah.
Or if you're like 30 minutes in on trying to get something done and you just can't, and there's like whatever the barrier may be as to like, I can't complete it, let it go and figure it out later. Set it aside for another day.
Yeah. Yeah. That's a good point. And then what about nutrition, like food?
So being so busy and on the go, we do end up ordering a lot of our meals, especially like lunches while we're both at work.
Yeah.
I really like sweet green. I like field of greens. I like just doing like a quick power salad with good protein, whether it's chicken or salmon. I'm a big hard-boiled egg girl because it's just quick. It's easy. You don't have to cook it.
Yeah.
I can eat it in the morning while I'm like prepping the kids for school, that kind of thing.
Yeah.
And just water. I mean, drinking a ton of water is huge.
Yeah.
I think adding supplements to water, like specifically salt and potassium, is really good and helpful. I think a lot of those packed hydrations, I'd like your opinion on that. We're so pushed and great, but we're finding that there's like a lot of sugar and chemicals, and really all you kind of need is like salt.
Yeah. No, good question. Like, the like electrolytes are super important, and like making sure we get enough water and just in general, where it seems like the most common things we hear is potassium,
Yep.
salt, and then
Magnesium is another big one.
And those 3.
Yeah.
And then enough, like there's all the ones you could throw in there, like if it's vitamin C, like ascorbic acid,
Mm-hmm.
and then some of the B vitamins, and that just it can get a lot. You know what I mean? Like it gets overwhelming.
Yeah.
And then people also like, what other supplements do I recommend to take and stuff? I've heard a lot of good things about turmeric and black pepper.
Yeah.
Anti-inflammation.
Totally.
Anti-inflammatory properties. And then ginger with that too. It's just challenging to get the right things.
Yeah.
Where what I did is I got a turmeric extract powder from a company online, like just a supplement company. But oh my gosh, turmeric stains everything.
Oh, it's so bad. Have you ever got it in your nails?
Oh, 100%. I'll be like at the clinic and I'm like, doing needling or like working with somebody, and I'm like, don't worry, this is not jaundice. It's just
my turmeric. I have a good turmeric roasted carrot recipe I'll have to give you, but you have to like massage the turmeric with olive oil onto the carrots, and like my nails are going to be orange for like.
I'll wear gloves for sure. I think I would like.
That's a good idea. I have access to a lot of gloves. So
imagine if
like wearing gloves.
But there was one morning where like I was up early. So like what I would do is I'll just get the bag, because my plan was to puree pure ginger, like organic ginger from the grocery store, and then have the pulp and like the juice and stuff like that, right?
Mm-hmm.
And then scoop in ice trays a scoop of turmeric and black pepper at the appropriate ratios with ginger, and then put some like orange juice in it and water.
Yeah.
And then have these thick ice trays and put them in the freezer and freeze them. And then once a morning, just pop an ice cube into a coffee or water, just have it melt and just drink it like water.
Yeah.
Well, the turmeric extract is so fine that it's like cinnamon. Like if you ever try to mix cinnamon, it doesn't mix.
It doesn't mix.
It just floats.
Yep.
So I'd be putting in there, I'm trying to mix it, and it's pluming as I'm doing
like
that.
Like a smoke.
Yeah. So I'm like, God dang it. So I'm like, I'm too deep at this point. I might as well finish. So I did, and it was just challenging. So now I just like take a dry spoon, like a tiny spoonful of turmeric, and I just, eat it dry with black pepper and black pepper extract.
That sounds kind of potent.
Well, the black pepper can be a little spicy.
Spicy, yeah.
But it's not bad.
Okay.
Right? So I took the black pepper. I have a black pepper extract bag and a turmeric extract bag. And so you don't need all the black pepper. It's just a little bit.
Yeah.
Because it improves the absorption by like 90% of your turmeric. So I mix it in the bag. And every morning I carefully take a little spoon and I'll just like eat it, take it on dry with like a sip of water.
Yeah.
But there's always turmeric on the cup that I just sipped because it was on my lips. And if for some reason my thumb dragged the bag on the way out of getting the turmeric, then it's on my thumb. And then there's one morning by accident, I was trying to, just eat it dry, and some spilled off the spoon on my way to the mouth.
Oh, no.
And I'm over the sink.
Yeah.
I don't know how it happened, but it got on the floor.
Oh, no.
And I didn't realize it. A little bit.
Yeah.
So I'm like getting ready for work, getting ready. It's like 6 a.m., right? Or like 5:30. And like, I put everything away. I go to the restroom. I come back and I'm like, there's orange all over the floor. Footprints of orange.
Stained from the kids.
All over no, it was me.
Okay.
I looked at my socks and I was like, oh, I was by myself.
Yeah.
In the morning. I looked at my sock and it was on my foot. I'm like, oh my gosh. Because it's so hard to get out.
Yeah.
So luckily, right at that moment, Nicole woke up and like she was at the baby.
Yeah.
And I think it was before Maverick was born, actually. But anyway, I was like, I'm so sorry. I have to leave.
Yeah.
But there's turmeric all over the floor. And I was like, is there any way that you can get like, before the kids wake up, that you can get like the thing out, the vacuum thing. And she did, luckily. It came up It came up simply. But I was like, man, but now the vacuum thing, like the little lavage, that's going to be stained.
That's stained. I know.
But to wash that.
Slippery slope.
I was like, I'm like, this is never happening again.
Yeah.
Like this, I have to be extremely careful.
Turmeric's actually one of the things, if I'm doing filler injections, I'll have people quit because it can actually lead to some more bruising easily.
So it's like it has like a blood thinner.
It's like a blood thinning effect. Huh. Yeah. So turmeric's on my list of supplements to stop taking about a week before a filler treatment.
Interesting.
With Botox, it's not as important. The needle's smaller. We're not going as deep.
Yeah.
But yeah.
I gotta look into that.
Turmeric's one of them.
Huh.
It's not that it's bad. It's just, I don't really want to inject on a patient that takes a lot of turmeric every day because they'll just bruise like crazy.
Interesting. Yeah. Huh. That's I gotta look into that. But anyway, other than that, like supplement wise, like electrolyte, hydration packets, I would say the priority that I've been hearing is magnesium, potassium, and salt, sodium.
Yeah. And
then turmeric, black pepper, ginger if you can, and then for sports perform, like for exercise, and and also some cognitive benefits is creatine.
Oh,
creatine monohydrate.
Yeah.
There's been found some cognitive benefits to that too.
Are you hearing anything about the use of colostrum supplements?
I have.
What's your thought on that?
Like, this is getting weird.
I know.
It makes sense, but I haven't looked deeply into it. I saw it and I'm like, no.
Yeah.
Like, it seems like we're getting a little aggressive. I don't know. What have you found? What have you read?
I've read about it being like kind of derived from cows. And again, I totally get the health benefits. I think there can be a lot for energy, for hair growth, nails, skin. I'm kind of into it. I haven't started trying it or taking it myself.
Like a shot, or like a powder?
It comes in like a powder and you can add it to smoothies or to coffee, that kind of thing. But
so what are the proposed benefits? Like, what is it for?
I think for energy metabolism.
Energy metabolism.
Yeah. Okay. Cell growth and just helping support cells. And our body's constantly making new cells in every part. So I think it can help with that. I think it can help with memory and cognition and just focus. So
interesting. I'm going to look more into it.
I know. I got to look more into it too. I was curious your opinion though.
I haven't heard. Yeah. Other than I'm like, okay, this is a little much, but I mean, it makes sense.
I'm definitely softening to the idea.
I mean, I could see myself that too. Like I said, I haven't really looked into it that much, but I know it's like the magic formula.
Yes.
Like the ultimate healthy thing.
Totally.
Like, what else would you give like a newborn infant that's extremely vulnerable and super dependent?
Yeah.
Not going to give him or her, processed deli meat.
No, exactly.
Let's just mix some of this in here. That's the most pure form of, health chemicals. That makes total sense. No, I appreciate you sharing more about your personal scheduling and like your priorities.
Yeah.
But I think the sleep thing is super important. And then just consistency. I think, I saw a good, talking about like things might not be 100% of the time, like consistency, because consistency is the most important thing.
Yeah.
But I would say like consistently making an effort to try to stay consistent.
Yeah.
With like nutrition and then fitness, sleep.
Yep.
I saw this really good metaphor. It was an Instagram thing, but I was like, I like this one. It was like, all right, I'm trying to stay healthy in a diet and exercise. I missed a week or like I ate weird for a week time or, a 5-day period or whatever. Like, well, you know what? All is lost.
Yeah.
Might as well just like go away. I lost everything. Momentum's lost. Mm-hmm. That's the same metaphor as like, imagine trying to pour milk in a cup and a little bit spills. And like, you know what? Might as well dump the whole jug now, spill the whole
I
thing
like
out.
that analogy.
I was like, that'd be dumb, right?
Yeah.
Just take a paper towel,
would do that.
wipe it up, and then just continue the path that you were on.
Yeah.
That's something that I've always struggled with,
Yeah.
where it's like, I missed a week, the momentum's lost.
Yes.
Everything's done, might as well just like let the floodgates open.
And like we were talking earlier, just being in this phase of like an early business, starting a new business on my own, you got to really try hard to stay mentally focused and not let little failures and hiccups and steps along the way bring you down and drag you down and say, I'm going to throw in the can.
Yeah, totally.
Just call it.
I totally agree with that. And it only gets more, but like, I think, man, like that entrepreneurial journey of a solopreneur, and then especially in the health and service-based industry.
Yeah.
Man, it was the best thing ever.
Yeah.
It changed my life, like of perspective,
That's
beliefs, efficiency, time management, priorities.
Yeah.
Cause like talking about like priorities, like, oh my gosh, talking about sacrifices,
Yeah.
I mean, I don't do anything other than I prioritize my kids to be home and like be an active father, get to bed as quickly as I possibly can, as best as I can, resist the temptation to snack at night. It's like, all right, I have a choice. I can snack and then doom scroll.
Yeah.
Or I can like not snack and then just go to bed.
I know it takes a lot of self-control.
It does. I'm by no means am I perfect.
Yeah. No, nobody is.
But usually it's like if they're not in the house, that's way better.
Exactly.
So
I've always been a believer in that. Like if you don't buy it and it's not there, you can't have it.
It's like, well, I might as well just go to bed. I don't have it anyway.
Yeah.
Alcohol is the same way. I don't not drink anymore. I definitely drink less.
Yeah.
But for some reason I just haven't like totally given it up yet.
Yeah.
But I think the key with that was just not grocery shopping hungry.
Yeah.
That's my downfall.
True. Yeah.
Because then I'm like, now I have all these snacks in here and stuff. I was hungry and I was shopping. That's the problem.
Yeah.
I got to prepare and plan.
One of my splurges is grocery ordering. It's so convenient.
Too convenient, especially with family.
Convenient with family. And then you're not in the store. You're not seeing it. You're like, okay, here's my list. Here's my cart. Just repeat it every week.
That's super smart.
Add on a few new things, remove some things.
Yeah, that's super smart.
It's like a guilty splurge.
That nothing wrong with that. We were for sure on that until we were on that until one recently canceled. But we actually enjoy going to I kind of enjoy going to the grocery store with the kids. Yeah. Usually it's like Nicole will have Mav like in the cart or like on her, like on a Bjorn or something. Yeah. And then I take the other two kids and we're just like sprinting up and down the aisles. Yeah. We just get energy out, Yeah. Like just see that aisle, run down there and back as fast as you can. Do that 10 times.
Yeah, exactly.
And they'll like continue and run around and like, shoot, now they're like both going opposite directions. Yeah. Hope they don't like run into somebody,
That's funny.
But that's a good energy outlet,
Yeah.
But yeah, so like, but anyway, talking about priorities, I usually go back to like, this is my own, I want to hear what you have to say, but like, I'm always just health and wellness and longevity. Yeah. What do I want? What is it that I actually want? Mm-hmm. All right. I want to be fit. Yeah. I want to have a good relationship with Nicole and my kids. Mm-hmm. I want to get good sleep and be energetic and not just like lethargic all the time and foggy. I want to be lean and healthy. What are the pathways? That's what I really want. Do I what I really want to do? Like, it's just a different lifestyle. Yeah. I want to be really good at fantasy football and win my league. That's going to be a lot of dedication and effort and something else. It's like, what's going to matter? What's going to matter in the 20 years from now? You know what I mean? Yeah. All right. Well, if that's what I want, what's the pathway and the checklist? Yeah. How do I structure my life and my time? It usually doesn't include, watching TV a lot. I know. Eating out because we're trying to want to be healthy and save and of course be financially responsible. Exactly. And then a social life. Yeah. We have no social life. At least I don't.
We have less of one, especially now having kids. Yeah. But I think it changes. I've got a good mom group at our daycare, and
totally.
On Fridays we kind of hang out. Yeah, but it's more like spending 10 minutes talking to a mom at drop off. I'm like, oh, I had my social fix for the week.
A little re-energizing. Yeah. Not just.
They're in it too. They're working. They've got kids. Yeah. We're all kind of in it.
It's funny. It's like if someone's coming over for a play date. Yeah. I'm like, oh, this is cool. Like another adult, exactly. We can just socialize about.
See what they're up to.
Exactly. Other than just don't pull her hair. Yeah. Put that toy down. You can't have candy right now.
Exactly. Put the crayon away.
Was that the best decision we could have made today? Yeah. Let's think about this.
Yeah, exactly.
That's really funny. Well, thanks for coming in. So if people want to find you, what would be the
Yeah.
best way to
So my social media has my address on it. It's at Crafted PB. Crafted Aesthetics PB is my social media handle.
Crafted Aesthetics PB.
Yep. And craftedpb.com. But all my information's on there, my phone. I can be texted, called, emailed. There's inquiry on my website. So yeah,
website,
I do.
craftedpb.com
Mm-hmm.
or Crafted Aesthetics, sorry. Craftedestheticspb.com
Yep.
or Crafted Aesthetics PB, Instagram,
Yep.
social media.
Yeah.
Cool.
So, and my consults are free. I can do virtual as well. I could do a phone call, video call, just have a chat with you and see what your concerns are.
And this would be people for skin health, skin care,
Anti-aging. Yeah.
Anti-aging and aesthetics.
Yeah.
Cool. Well, thanks for coming in.
Thank you for having me. This is really cool.
You're busy and stuff. We'll have to have another round of, another podcast.
Yeah.
Talk about
Catch up again.
other stuff. And if you have any questions, we're always open to opinions, conflicting opinions, suggestions, options, questions, whatever. And if you're battling any pain, don't hesitate to reach out. Because we do sports physio. That's what we do at our spot. But the best way to reach out to us is probably our phone number at 561-899-8725. Like I said, just reach out if you have any questions. We'd love to at least talk and help if we can. And we'll catch y'all next time.